Welcome back for another episode of the Chamber Podcast. My name is Rob Johnson. So joining me in the studio today is Patty Meyer. She is the Executive Director for the Key Development Center here in Brighton, Michigan. Welcome to the show, Patty.
Thank you for having me.
Absolutely. So Patty, tell me a little bit about kind of the mission for the Key Development Center and what the organization seeks to do here in the county.
Sure. Well, I think it's our mission is pretty simple. We're opening doors to recovery, health, and well-being, which encompasses a lot of things. So we've been in Livingston County since 1999. We've grown a lot over the past several years. We are a 501c3 nonprofit. We have greater than 600 individuals who come through our doors each year. And what we provide is we're a full-service substance abuse mental health treatment agency. So that's what we do. We treat people, whether they have a substance use disorder or whether they have a mental health problem. Doesn't matter. We treat one, the other, or both. And quite often it's both. So that's who we are and what we do. We're located in the Grand River Annex in Brighton, so right off Grand River, kind of between Howell and Brighton. So pretty accessible because that's part of what we need to be as a nonprofit. We have to be able to be accessible by bus or, a lot of people drive themselves, but we have to be accessible to the people.
Yeah, absolutely. So I want to know a little bit more about you. So tell me, how long have you been the Executive Director at Key?
Okay, I've been the Executive Director at Key since 2018, so the last 6 years.
Excellent. And what kind of brought you to the path of working in the substance abuse therapy and just overall, helping people, treating people? What kind of led you to that path?
A lot of things. I've been doing it for quite a while, so this is greater than 25 years. I've been in the field of mental health, and oftentimes substance abuse goes along with that. I've done a number of positions working in an administrative role, but I'm also a therapist by trade. So I've worked with people. I think that gives me a bit of an edge in terms of understanding what my staff need and what the clients need. What led me to it, I think it was grad school. Honestly, I had one class in substance use disorders, and I enjoyed it. I jumped right in with both feet, did a little research, and that was kind of how I got started with it. My training ground was at Northville Psychiatric Hospital, working with individuals with severe mental illness and substance use disorders. So I trained well and hard, and so it's led me to doing this work ever since.
Excellent. And how do people typically find out about Key Development Center?
Well, I think we serve a large population that is referred by the Livingston County Community Mental Health. So that's one of the ways in which they hear about us and they come through our doors. And so that's the primary route, is through the courts, through the local community mental health, through private insurance agencies. Oftentimes, if you look, you have an insurance card, right? And the insurance card says, okay, these are the providers that accept your insurance. So it comes that way. They hear about us through word of mouth. We do every event in the community that we absolutely can to kind of talk about who we are and what we do. It's an important piece. It's a hard first step for people with substance use disorders. That very first phone call to us is huge. Yeah. And it takes a lot for people to make that first phone call. And so part of who we are and what we do is being able to help that person and not really even thinking about how they got to our door or who's going to pay for it.
Sure.
My own personal passion in my career has been to serve all people, regardless of how it's paid for. Very important piece. When I go to the physician, he doesn't ask me what insurance I have. Not usually, unless, they're going to do something that's really expensive. But other than that, nobody really asks me that except for the front office staff, right? And so I don't ever feel like that's something I have to worry about, and I don't want other people to ever have to worry about that. So my mission over the last 6 years personally was to be able to serve all people regardless of their ability to pay.
So over the last 6 years since you've been executive director, what has the I guess what's the temperature been for the needs of those services over the last 6 years? Have they grown? Have they declined? Like what are we seeing right now in Livingston County?
Well, I think certainly our numbers have grown since the pandemic. I think that probably goes without saying. But the needs have always been here. I think it's been hidden a little bit.
Sure.
No community ever wants to think that is happening in their backyard, that people are struggling with addictions. And the reality of it is they are. And we need to be able to address their needs. We need to bring it out in the open. And that's what we attempt to do. That's why we go so many places and talk about what it is we do. Treatment is confidential, right? So it's, people can come and they have that complete anonymity. And in Livingston County, everybody in every county, people are proud. They don't want to say, I have a problem.
Sure.
That's really, really hard for folks. So, we try to remove any barriers that we can. But, yeah, in Livingston County, it's a problem.
Sure. So obviously, there's problems in every county, and that's why, treatment centers and facilities like yours exist. So I'm sure there's a lot of pain in your job at times, and I'm sure there's a lot of joy as well. What's one of your favorite things about working at the center there?
Oh, honestly, in my role, it's the team approach that we have. We're very comprehensive programming at Key, meaning we do a lot of different, we have what we would call a lot of different levels of care. I love the teamwork that we have with all of our staff. We're all very passionate, and every day that's what brings me back in the door. But it's also the people who actually succeed. Substance use disorders, chronic, it's reoccurring, and it happens often for some.
Yeah.
But when we finally get somebody who's embraced recovery and they're able to live a sober lifestyle moving forward, that's absolutely the, ice cream on the cake, because
Sure.
That's a win. Even if it's just for a period of time, that's still a win, but it's making people feel better and giving them hope, because that's huge. If you don't have hope, you don't have recovery, right? So,
Sure.
Seeing the look of hope in people's faces.
What do you think is one of the biggest kind of misnomers or things that people mistake about people that are going through, these hard times?
Oh, it's that, it doesn't matter the education level. It doesn't matter whether they're in poverty or they're actually doing very, very well. Addiction it doesn't discriminate, right? So I think that for people to think, well, that doesn't happen to people who are well educated, or people who do this or people who do that. That's only those people, and they don't care.
Sure.
And that's not true. Addiction is a disease. It's so hard. And for people to recover, they really have to work at it, but it's not easy. So for people to say, well, just don't do it, that's not one of the options for a lot of people.
Sure. Absolutely. Now, I know in the pre-show we were talking a little bit about your this partnership you have with Trinity Health. Mm-hmm. You guys had a new grant that was issued. Is that right?
That's true. We were fortunate enough to be awarded grant funding from Trinity Health Livingston and Ann Arbor. And this will fund not some of the current programming, but it'll also fund what we call an intensive outpatient program. And this money will be reserved for those individuals who don't have an ability to pay. Because there are people who are underinsured, or people who don't have the ability. They may be insured by the insurance company, but they have an $8,000 deductible that they have no ability to pay.
Sure.
Right? They don't have disposable income. So it's this population that we're trying to serve, because one of my goals every day is to make sure whoever calls that they get treatment. And it's not about whether or not they can pay. It's about whether or not they're motivated to be there and they want it.
Yeah.
And so, Trinity was able to award us that grant funding for the next 1 year to provide services to all those people who might not otherwise get them because they don't know how to pay for it. So I'm very proud to have been awarded that grant, because it also is going to serve, we're also going to be able to do a research project with this grant funding, where we will look at adjunct treatment and what that and how that affects patient outcomes. And so, it's kind of twofold what we're going to be doing with this funding. But we're going to specifically look at medication-assisted treatment, which is a hot topic right now.
Yeah.
And so medication-assisted treatment being medications that are used to help people with reducing cravings. And that's very important because that's the hardest part in the disease of addiction is that sometimes people need just that little extra edge. So we are fortunate enough to have a board-certified addiction medicine physician on staff, Dr. Jeff O'Boyle, and he's helping us in this project, but we're, being able to offer this medication-assisted treatment to all people, and not just people who may have insurance that's really good, or they might be funded through a different entity, but to those people who may not otherwise get it. But really being able to study this at length so it's informative.
That's excellent. That's excellent. It sounds like it's going to go to, towards starting to help a lot of people heal, recover.
Yep,
so.
I hope so.
So what can people in the community do from an awareness perspective or from a support perspective? What are some things that people in Livingston County can do?
Well, I think, I haven't met anybody yet that didn't know somebody with a substance use disorder.
Sure.
I mean, including myself. Everybody's, got the uncle or the grandfather or the parent or the spouse that has an issue with substance use. And, and there's plenty of people that can use substances and never become addicted. And that's fine and used in a responsible manner. But there's also plenty of people who are really unfortunate and they are addicted and they need help. So what can the county do? Refer them our way. Let us help them. Because that's that's why we open the doors, right? That's our mission. Just come in, let us help you. Many of our staff are just dedicated to the field of helping individuals, and that's what we do. So
I love it.
Yep, just refer them our way so we can help them.
So if you want to know more about Key Development Center, all of the links are going to be in the show notes for the episode. Patty, anything else before we wrap up today?
I don't think so. I just invite people to look at our website. Please know that we have a very comprehensive programming, meaning that if somebody needs, it doesn't matter what they need, we help them find it, because we have not just individual therapy, it's way more than that. They can meet with a peer for peer recovery mentoring. They can meet with a therapist. They can come to an intensive outpatient program. They can see the addiction medicine physician. They can meet with a case manager if they need food, if they need housing, if they need resources. That's what we do. And when I say very comprehensive, that's what we are. It doesn't matter what you need. The most important thing is we meet the basic needs of people, and then we help them get through this recovery process and resolve their mental health issues as well.
Excellent. Well, thank you for taking the time to be on the podcast today, and thank you for everything that you do in the county here. We really appreciate it.
Thank you for having me.
Absolutely. All right, everyone, that's going to wrap up this week's episode of the Chamber Podcast. I appreciate you all watching, and we will catch you next week. Take care.